The escalating costs of veterinary care, the corporatization of veterinary clinics. This is what you can do to actually afford veterinary care for your dog or cat.
Are you looking to learn more about natural pet health and wellness? You've come to the right place. Click the link to subscribe to Veterinary Secrets.
Hi, I'm Dr. Andrew Jones. If you've been to the vet recently, I'm sure you've noticed something. The cost of pet care, it has just skyrocketed. Today, we're going to talk about exactly why this is happening and, more importantly, what you can do about it. In the last 3 years, veterinary costs, they have dramatically increased, just making it so difficult for so many pet parents to just even afford veterinary care. So what's really behind this? In a nutshell, there's been a corporate takeover of veterinary medicine. Before 2010 in Canada, the United States, majority of the veterinary clinics, they were owned privately by an individual veterinarian. You would go see Dr. Jones, for instance, at the Nelson Animal Hospital. That clinic, it was owned by Dr. Jones. You're taking your cat or your dog to the vet to see Dr. Jones? It was owned by Dr. Jones. Fluffy or Cassian? You're looking a little bit chunky. It's okay, kitty cat. But today, the majority of the referral clinics in Canada and North America, they're owned by corporations. Nearly 40% of our general practices in the US, they're owned by corporations. Nearly 25% of all general practices in Canada, they're now owned by corporations. In the United States, you have the Mars Company owning over 2,000 veterinary practices. In Canada, you have Vet Strategy, VCA Canada, owning hundreds of clinics across the country. So you have got these corporate giants with international investors. They are quietly buying out the independent local veterinarian. No one is even knowing about it. Often, this takeover occurs, they're not even informing the pet owners. And they're kind of doing it sneakily. For many of these practices, there's still no branding at all, no information that would let you know when you go into that clinic that it's now gone from the local independent veterinarian to big corporate chain. You'll go in and you still think, oh, it's my same old clinic. You know what? No, it's not. Why are prices going up and up and up? I think because they're corporations and they're focused on one thing. The almighty dollar, they're focused on profits. There was a recent investigation done here in Canada, and they actually looked at a bunch of the different corporate clinics within Canada. They took in a young, healthy dog. They described the symptoms of a dog having an uncomplicated UTI, just a urinary tract infection. The prices, they just were all over the board, even amongst the corporate practices, even amongst the same corporate practices. They all charge about the same for an exam fee, anywhere from $125 to $150. Okay, you price shop on the phone and see, okay, it's about $125, $150. Maybe I'll just go to Clinic A versus Clinic B, doesn't really matter. But once you step in the door, then it becomes, clients don't know what the price of the diagnostic test was. They examine your dog. Bit painful here. I suspect Fluffy here. She's got a urinary tract infection. We've got to do a urinalysis, at least. But there's a wide variation in urinalysis tests. Clinic A, as low as $47. Clinic B, as high as $170. How can that be, you wonder? Another client talked about bringing your cat in, Cassie, who wasn't feeling very well. Who knows? Brought her into what she thought was her local veterinary clinic. They gave her a bit of an exam. It's about $150. And said, we need to do a few tests. So as they whip her to the back room, a whole battery of diagnostic tests. And then they came out with a $1,100 bill. She didn't consent to that. She had no idea there was going to be that kind of expense involved. And there she is. She's left with her cat who's sick. They're saying it's $1,100. Well, I guess I need to pay it, right? So what's happening here is these clinics, they're using a strategy called creative pricing, which means that you as the client, you may be price sensitive to the cost of an exam. Exams, they seem to be about the same for all animals and most clinics across the country. But when it comes to diagnostic tests, they know that people don't ask about the cost of the diagnostic tests. So once they get you in the clinic, then guess what? Then they can really increase the price. So that's why all of a sudden you've got a urinalysis that went from $47 to $175. You didn't know it's going to cost that much. Creatively, they could increase the price. But not only that, some of these clinics, they were recommending so much more. So yes, they said, yeah, it's possible your dog, they have a urinary tract infection. That's what it sounds like. But I think what we need to do today is we need to get the urine sample. But we need to do it with an ultrasound. That's going to cost an extra $400 or $500. An ultrasound guided needle aspirate of the urinary bladder doesn't make any sense to me. I did it in practice probably 1,000 times. No ultrasound needed, but that was suggested. Then on top of that, at this same clinic, they said, while we're doing that with your dog, I think we should also take some x-rays, which is going to be another $200 or $300. So what should be, really, in my opinion, a $150 procedure and potentially even cost when you go home with antibiotics, they've run that up to now $1,000. Like, how can that be? So what's the worst thing that's happening because of all this? We're seeing that many pets, because their owners, they can't afford veterinary care, they're having to have their animals euthanized. What? Your dog, your cat, they need some form of, life-saving treatment, but you can't afford the diagnostic tests. You can't afford to pay for the medication. Like, what's your alternative? And you're left with the ultimate horrible choice to euthanize your dog or cat. And the big danger here is when you start seeing the local veterinary clinics starting to match the prices of these corporate veterinary clinics, you're just putting veterinary care completely out of reach for so many people. It really is not fair that someone has to choose between their pet's life and being able to put food on the table and feed their family. Like, how is that fair? So as a pet parent, here's some key steps you can take. Number one, find out who really owns your veterinary clinic. Ask your veterinarian. Check their website. Do an internet search of corporate-owned veterinary practices within your town or your city. You're going to find out exactly who owns that practice. And if it's corporate, I would suggest you think twice. Number two, before you approve any treatment, get a specific, detailed estimate. Exactly what they plan or suggesting to do with your dog or cat. And then you know exactly the underlying cost before you consent to anything. And really question and ask your veterinarian, is this necessary? Do we need to do these diagnostic tests on Fluffy Tula here? Do we need to do the ultrasound? Do we need to do the x-rays? Or is it possible you can just get a simple urine sample, find out my dog has a UTI, and give me an antibiotic? Because you know what? In majority of the cases, it often is. But you need to ask. You need to specifically ask, and they need to give you an answer. And number three, do some price shopping. Get on the phone, search, talk to the other local clinics, get an idea what exam fees are, but also get an idea what other diagnostics are. What does it cost to actually go in and get a urinalysis? Clinic A says $47, Clinic B says $175. You got to wonder, why is that? Prices vary even amongst the corporate practices. Number four, consider pet insurance. For Cassian here, we adopted about a month ago from the SPCA. He came with pet insurance. So I've kept it. At the very least, it can help a high offset, unexpected veterinary fees. Maybe it's not going to cover everything, but it can cover the basics. Obviously, you need to look at different insurance policies and see what they're covering or not. And I think it's a good thing to consider. I've got Cassian on pet insurance. Probably going to stay on that. What a big nose you have, Cassian. Yeah. Oh, kitty cat. Number five, if you're not sure, by all means, go ahead and seek a second opinion. They say your dog has X. Do I need to do this whole array of different diagnostic tests? Before you consent to any of those, maybe then it's a good time to go see a second, hopefully non-corporate owned veterinary clinic and veterinarian who's going to give you a more realistic, number one, assessment of what they think your dog has, and then number two, an actual affordable treatment plan. Number six, use local independent veterinarians. My former practice, the Nelson Animal Hospital, they are still independently owned. So yes, if Tula is sick, if Cassian is sick, he or she is going to go there. The other major competitor though, they're now corporate owned. Obviously, you still need to do your due diligence, getting an idea what their costs are. But in general, I think you're going to get a fair price, better service, a more honest answer at an independent vet. Then number 7, last but not least, you've got to learn to take matters into your own hands in terms of being a proactive, empowered pet parent that is willing to learn about alternative veterinary care, is willing to learn about basic veterinary care, like basic veterinary procedures, going to learn about pet first aid. I want you to think about, what you can do if your dog has a recurring ear infection that doesn't involve just going to the veterinary clinic again and again and again, biting the $75 tube of Automax. It keeps squaring in, it keeps coming back. Go through so many things that we have on this channel. Become more confident and empowered, and be willing to potentially help your dog or cat at home with these whole array of often really inexpensive home remedies that we're often finding can be really, really helpful. Over 10 years ago, I was interviewed by 2020. I discussed much of this during that interview.
So for instance, seeing a dog that has a little bit of tartar, then I might say, I think your dog should have a dental cleaning. Obviously more profitable for the practice.
Do vets really push unneeded services, as Jones claims?
Turns out I didn't become very popular with the rest of the veterinary profession. And during that interview, and you can refer back to it, I talked about upsells, right? Guess what? Veterinary man is a business. Whole lot of upsells going on now. I talked about things being done which I didn't think needed to be done, i.e. excessive number of diagnostic tests. You think maybe an ultrasound for a simple uncomplicated UTI is an excessive diagnostic test? I do. Sometimes that's still happening. Or animals being recommended that they need a dental scale and polish, which is going to cost in excess of $1,000, when all they have is a little bit of mild gingivitis. They're shareholders. These are big corporations. They were doing what they can to maximize profit, to maximize return for the shareholder. Great. Good if you happen to own shares in that company. Not really ideal for your pet. Because at the end of the day, it should be your dog or cat's health that is a priority, not corporate profits. I think we should be doing this and doing more of this. Thanks so much for watching this edition of Veterinary Secrets of the rising costs of veterinary care. More importantly, what I think you can do about it. Click up there to subscribe, hit the bell to sign up for notifications, and when you click that link directly in the box below, I can send you a copy of my free book.